The presentation number 3, and that is generally with coryza. Lot of sneezing, lot of coryza, lot of cold and cough, lot of discharges from the nose. I'm going to show you one of the cases, and then we'll also try to find out what we did in the case. So, case of coryza, 48-year-old lady. She was already my chronic patient, but suddenly she also had a very bad COVID last year, where she got admitted in the hospital, and she went through hell. I want to tell you, she is a family friend. She went through hell. She was put into the hospital, and she stayed for almost 3 weeks, and they didn't let her take homeopathy, and she was so bad. And when she came out, the first thing she told me, when she came to meet me after a few months, she told me that, Gaurang, I should have just contacted you and taken homeopathy from you. I don't know why I took allopathy. Everyone scared me. So this time, she got throat pain and coryza and headache. And she got her COVID test, and COVID test, the antigen came positive. So she said that, and she speaks in Gujarati. And I know Gujarati a little bit, not totally. So she told me that, abhi main tera hi dawa lungi. I said, yes, I will get you out. I love it when someone can trust you so much. It's just a kind of a very beautiful feeling. Yeah. At least you can try to do your best. Maybe. Maybe not. So she describes a lot of coryza, lot of headache, lot of burning. She described a lot of burning all over the body. Forehead pain, which is better by pressure. Body pain with burning and heat. Burning heat in fever. Burning of hands and legs. The thirst is more in fever, she says. There is a lot of burning during urination, she says. She just feels like lying down all the time. Constantly feels like lying down. No desire to do anything. She also feels very acidic. Heaviness around the eyes, forehead. Warm water makes her feel better. Maybe she's stressed. She had a lot of sweets, ice cream, cold drink. And maybe that's how her cold and cough started. She wants to cover constantly. She feels like covering her ears. She feels very chilly. So she took bryonia and some more medicine. Didn't help at all. Okay. So now I try to study her case again. I said, tell me your symptoms again. So a lot of coryza, and this coryza from the nose, especially nose obstruction. It is only one-sided and typically more on lying down at night. Lot of headache, forehead pain, constant desire to lie down. The neuralgia pain is more difficulty in talking, very difficulty in talking. And she also is a known case of trigeminal neuralgia, okay? Cannot bear to be touched, lot of burning. She has a lot of desire for warmth too, wants to be alone. Then I ask her, and this is very peculiar, okay? In the acute, she tells me, I get a dream, but I get one dream. I said, tell me the dream. She say, I get dream that I'm sleeping. And then in the dream, I'm suddenly trying to scream. I'm trying to scream. And my voice is not coming out. I'm trying to scream, but my voice is not coming out. Then, interesting, no? Yeah. You have to learn to kind of understand the peculiarities. If you understand this, then you can understand anything. So let's try to analyze, okay? So first symptom, a lot of obstruction, no? Obstruction typically at night. Obstruction typically one-sided, isn't it? Yes or no? And lot of dreams. And what is the main feeling in the dream? Dreams that she's trying to scream, shriek, Dream, shriek, unable to, isn't it? So when I just analyze this, you know what remedy will come? Any idea? Hello? Yes, there are two remedies that come, but the main remedy that comes throughout is the remedy ammonium muriaticum. Yes, ammonium muriaticum. And why is it a very beautiful remedy? Because it covers her main symptoms. Because after this, we start looking at the materia medica. Let's see materia medica. When you open ammonium muriaticum, what is the symptom? First is profuse glary secretion, very important for cold and coryza. And then you see the symptom, lot of watery nose discharge, burning the lips, burning, sneezing, loss of smell, and obstructed feeling in the nose, constant and unable to blow it out. This is the main symptom of ammonium muriaticum. So beautiful, no? Ammonium. And there were more symptoms, okay? I forgot more symptoms to tell you. I forget all the symptoms. I just note down the important ones so that I can remember to tell you. And beautifully, ammonium just within one dose, huh? I think I gave 30 potency. Beautifully, one dose. And that's why what I was telling to few of the doctors working with me, that in acute, in about 24 to 48 hours, there should be a remarkable change, or at least the suffering should reduce. Or else we are somewhere we are not, really the remedy is not correct. You need to look at the potency or the repetition, or we need to look at another remedy. You know? So let's come to coryza, ladies and gentlemen. Coryza and sneezing, there are many, many remedies. I'm going to tell you some of them. Ammonium mure, ammonium mure, hot watery discharge, obstructed nose, constant desire to blow, ammonium muriatic. Another very beautiful remedy which we are using, as you already know, is sticta. Sticta is a remedy I had basically, which I had almost forgotten. Almost I was not using till many years. Still about a couple of years back, um, one of my very close friend, Dr. Alpesh, he told me some very beautiful symptoms of sticta that he's using. And after that, I was able to prescribe sticta very nicely in acute cases. So a lot of my knowledge in sticta is thanks to my friend Alpesh. Sticta has a lot of dullness, indolence, and a lot of fullness at the root of the nose. And the main symptom is a lot of dryness. So even if they sneeze, there's a lot of dryness feeling. And that's why it's a very important remedy in some cases of presentations in COVID. Dryness like sensation. N.M. Chowdhury very beautifully writes in Sticta that it is as if the discharge, the sneezing, the coryza, as soon as it is formed, it dries up. That is the beauty of Sticta. It comes very close to bryonia, by the way. Very often, some cases where we are giving bryonia could just be Sticta. Two more remedies. You already know Rustox. Rustox also very important remedy for coryza with this body ache and all this. Nux vomica also very important. One of the lesser known remedies that I want to tell you about is Sabadilla. Now, this is a very beautiful remedy. The main symptom of Sabadilla is with this coryza, there is a lot of lacrimation, a lot of itching in the throat, and they constantly want to eat something hot and they are very hungry or drink something warm. This is typically Sabadilla. If there is no itching, it cannot be Sabadilla. There is either itching in the nose, itching in the throat, somewhere. It's a little hay fever kind of remedy, Sabadilla. Interesting, no? Another beautiful remedy, Cistus canadensis. Lot of coldness. You know, when they breathe inside, it is as if they are breathing menthol. That's a typical symptom of cystis. Okay. Which remedy Clark has written that this is to dry cough, what arnica is for injury? Which remedy Clark has written? Tell me. Batao. How many of you read Clark Dictionary Practical Materia Medica? When I was in my internship, I had finished all the 3 volumes of Clark, in and out, page by page. You should do it as well. You should do it as well, and you can do it as well. You can do it. Yes, some of you are right. So the remedy for dry cough is Mentha piperata. What has Clark written about Mentha piperata? Let's read it. I want to basically, the reason to tell you all these kind of things is just to inspire you. I feel if I tell you one or two these kind of things, you will listen to it, and maybe 1 or 2 of you will feel inspired. I will also do it, and you will do it. That's the main idea. I hate to blow my own trumpet. In fact, when anyone is talking about me, I just like to look here and there and go away from there, because I only feel ye case of kya hai. But anyways, I should just tell you. So you can see here it is written Mentha piperata. It is to dry cough, however caused. What arnica is to injury and inflammation. Mentha piperata. Dekho, see the beauty. Isn't it so beautiful? Our materia medica, our repertory. Yes or no? Then why are you not really going in depth and mastering it? Batao. And the other 2 remedies which I also have used a lot in Coryza. One of them is pulsatilla. Pulsatilla is such a typically great remedy that you know about very well. Mucus discharge. So a lot of mucus discharge, which is profuse, bland, and thick, or yellowish greenish discharge. And you know the typical symptoms of pulsatilla: the thirstlessness, the desire for open air, the chilliness in a hot room, and the typical pulsatilla sensitivity. But the remedy which I feel I've used most often, and it's also something that I want to tell you that I do very often, is the remedy Calimure, and I've used it especially in the biochemic Schussler salt technique, 6x potency, especially typically cases who have a slight discharge from the throat, slight discharge from the nose, yeah, and whitish coating of the tongue. The discharge is whitish. They feel slight body ache, slight indolent, little muscle ache. Calimure 6x. Calimure 6x can stop the inflammation which is happening in the lungs and the mucous membrane. So I generally can use Calimure 6x along with the regular medicines very nicely. And also, you should know the great symptom that Boric has written about muriaticum very beautifully. Very beautifully he has written. Let's see. What does he write? Yes, hospital sore throat. What does this mean? Hospital sore throat. Which means if a patient meets or goes into a hospital where someone is sick, someone has an infection, and he comes out and he also gets an infection of the throat, that is typically what is called as hospital sore throat. And this is what happening. If your friend, your patient tells that, I met my friend who was sick and he had COVID, and after that I developed throat infection, and you check his tongue, it is whitish in color, he has slight body ache, and his cough, his expectoration is whitish in color. Think about Calimuriaticum 6x, ladies and gentlemen. Are you understanding this reading between the lines of clinical homeopathy? Dekho, ye padho aap. You try to understand this. Calimuriaticum. It's such a remedy I've used so much in the last few months. In fact, in the amount I've used Calimure in the last 1.5 years, and I use this remedy a lot, even in some cases in Brazil, in some cases in Europe. Beautiful results. Many doctors who have been attending my courses and have been using Calimure 6x have been telling some beautiful results, how they have even avoided many complications, post-COVID, post-vaccination complications have been avoided with Calimure 6x. Beautiful remedy. So, namaste from Mumbai. I am Dr. Gaurang, based in Mumbai. So, we have just recently started the course on classical homeopathy. This is a 7-month course. It's a weekend online course, one of its kind, with close to about 20 global homeopaths teaching so much in depth about organon, materia medica, repertory, that I would want to invite every single homeopath there for this course. You can join anytime. It would be 120 hours. It would be only weekends. and the recordings will be available for 1 year, so you will get to see the videos again and again close to 1 year. So that would be a major advantage for any homeopathic student who is either studying homeopathy in college or an intern or a practitioner. There is something for everyone. Once you join the course, you also become part of one of the WhatsApp groups, one of the top WhatsApp homeopathic groups, or a top group that we have curated, where we'll be putting up a case every week and you will be solving cases. So this solving cases helps a lot. Now almost close to 50 cases we have put gradually. We are going to be putting, and you can solve it. That's a very special thing that you could do. Not just about organon, materia medica and repertory, we'll also talk so much about different approaches. You're treating cases of acutes, how we can treat cases of currently acute COVID, how we are using remedies like streptococcinum, pyrogenium, influenzinum in today's acutes, how we are using the remedy China, for example. Today I saw a case, chills begin from back. One of the top remedies, Eupatorium perfoliatum. So these kind of very important kind of clinical indication. We will also talk about other approaches, how to treat hormonal cases. Here in my clinic in Mumbai, you can see this is my clinic. We are treating many PCOD cases, thyroid cases, endometriosis cases. What is the approach? How I use sarcodes, how I use nosodes, how to use organ specific remedies, how to use backflower remedies, how to use star of betel, how to use biochemics in today's time with cough and cold, little dullness, malaise, whitish discoloration of discharge, tongue white, muriaticum 6x, how we are using it. So there are so many different approaches we are going to be talking, and that is why with open arms I want to invite every single one of you. You can join, be a part of us. There are close to 650 doctors who have already joined, and we have a limit of 900 seats for now. So you can write to us, write to me. There will be an entire email ID with all the details of the course below. You can write gaurang@gmail.com, and it would be so good to study with you. Namaste.